Good afternoon. For today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director for Greenfield Health Department, Tia Ostrike, Bilingual Psychotherapist for 16th Street, and Long Shang, Project Manager for the Hmong American Friendship Association. Thank you all for being with me today. And I'll hand it over to you, Mayor Barrett. Or perhaps we can start with County Executive Crowley today.
All right. So I guess I'll start off with things related to testing. So I just want to make sure that people are aware that the Wisconsin Department of Health Services has a hotline for folks who's been to the National Guard testing site. And if you have not received your results in 5 or more days, there is a hotline that is available Monday through Friday from 8 to 6 p.m. And so I'm going to say the number is 1-866-419-6988. I'm going to repeat it, 866-419-6988. You can also visit or call Impact 211 for more details about that hotline. The other thing is, as we've seen across Milwaukee County and different municipalities, but now we're also seeing local businesses starting to require masks in their facilities, and so, or in the community. And so I want to remind folks that as we continue to see masks, that we start to check our biases. We know that there'll be many individuals who may wear masks, and so we just want to make sure that we make this normal. And so, enforcement of mandatory masking must be equal, and so people of color or whoever they may be must not be singled out and receive different treatment if they're wearing a mask or not wearing a mask. We need to make sure we're not stigmatizing those who are wearing a mask or not wearing a mask, and just be conscious of the biases that are at play. And so as we talk about racial equity, it's important to highlight that July is also the National Black, Indigenous People, and People of Color Mental Health Awareness Month. We're honored to be joined by 2 guests from 16th Street and the Hmong American Friendship Association, also known as HAPFA, to talk about the accessibility challenges and the stigmas that exist when it comes down to receiving mental health services, and to share the resources in the community that are available to help. Because COVID-19 has really spotlighted the racial and health disparities that exist in our communities, particularly in communities of color. And these issues do not appear overnight. There's more work to be done to make mental health resources accessible, affordable, and culturally sensitive. And that's one of the reasons why Milwaukee County is dedicating $1.6 million of CARES Act funding to the Behavioral Health Division to continue providing mental health wellness and support services for our most vulnerable communities. And last but not least, we do have a bike drive again that I want to make sure that we highlight that is happening this upcoming weekend. There'll be 2 bike drives, Saturday, July 18th from 9 to 5, both at King Park and Kosciuszko Park. And the bikes will be distributed and donated on a first come, first served basis. So if you want more information, please visit thewecarecrew.com for more details about these events. And with that, I see that the mayor has joined us, so I'm going to hand it off to Mayor Barrett. And thank you for your leadership.
Thank you very much, County Executive. And I want to talk just about a couple issues today. And I don't have a lot to add to what the County Executive said, but I want to talk a little bit about our Restart Milwaukee program, because we've really had a beginning of a very successful program here. And this is the program that's geared to small businesses that have 20 or fewer employees, and in addition have $2 million or less in annual income. When we put this out about a month ago, we didn't know what the response would be. And we've had literally hundreds of businesses who have contacted us applying for this money. The maximum grant is $15,000. Although all the applicants did not apply for $15,000. But we probably will have, by the time we're done distributing the first run of this, 400 businesses that will benefit from this in every single aldermanic district of the city, which I'm very, very pleased with. 40% of them self-identify as minority-owned businesses or businesses owned by women. So we're seeing a lot of equity there, and we think that that's very, very important. And so the total amount that we'll send out the door will be about $4 million. This is money that comes from the federal CARES money, just so people understand where the money's coming from. And we thought it was very, very important as we receive that money to help small businesses in particular get their legs beneath them. We know what a difficult time this has been for businesses, not just in the city of Milwaukee, but throughout the country. And this will go to help pay for PPE equipment, help to reconfigure layouts of stores. In many instances will help to replenish the inventory of the business. So we have had restaurants, we've had pastry stores, we've had bakeries, we've had a bike tavern, we've had funeral homes, we've had many, many different businesses that have taken advantage of this program, and that's exactly what we wanted. We're going to continue to look for ways to use this CARES Act money to help businesses, because we do think that's very, very important. I also want to follow up on some of the comments that the county executive made with our mask ordinance, which is now in effect. And as I said at the signing of this, oftentimes when I sign an ordinance, I'm really excited. I'm very happy to do it. This was not one of those occasions. And the reason it was not one of those occasions was because by signing this ordinance, it's a recognition, which is, I think, is a recognition we have to make, that we have not done everything that's necessary to fight COVID-19. And I would love to say that everything is going great here, but I think you'll see from the number of deaths, and Dr. Weston can talk about the number of deaths we've had. We've had a increase in deaths, and I had a young woman that I literally grew up with who just passed away in the last 48 hours from COVID-19. So I think more and more people are seeing this hit individuals that they know personally. But what we are seeing is we're seeing good compliance out the gate. If people are looking for masks, they can certainly get them from one of our healthcare centers on the northwest side, the Keenan Health Center, on the south side at our Southside Health Center. They can also get them at the Zeidler Building. And we'll have more locations. And we are going to make a very concerted effort to get these out into the community. And the county executive was talking about the racial equity components of this, and that's something we feel very strongly about at the city as well. But we're pleased that we're seeing a good response so far. And again, I understand there's some people who don't like them. I know some people think this is all political. It's not. It's about saving lives. And what we have seen in the 4 months that this has really been upon us is we've seen the average age of people who contract the disease going from the largest group between 50 and 60 to now the largest group being those individuals between 20 and 30, the invincibles, the young people who think they're Superman or Superwoman. And they may be, but they may be asymptomatic and they may be carrying this disease and infecting other people. So it remains a very, very serious concern. And we are taking it very, very seriously. So with that, I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers. Turn my video on. Good afternoon. First to our numbers, we have 15,179 confirmed cases of COVID-19 in our community and 365 individuals who've died. As we see much of the rest of the country moving in the wrong direction with their case numbers and their percent positive of tests, we've seen similar moves in many counties throughout Wisconsin. And now we're beginning to see some trends and numbers in Milwaukee County that suggest we may be going down the same unfortunate path of increased true burden of disease. We're seeing daily case counts similar to what we saw in our previous peak in mid-May. Along with those case counts, we are also seeing a gradual increase in our percent positivity. While the positive trend over the last 14 days did not reach significance to change our indicator color today, we are seeing a significant positive trend when we look over the last month that suggests a true increase. Finally, we see today the highest number of COVID hospitalizations in our county that we've seen in over a month. This is a single data point, but one of concern that we'll continue to monitor closely. Each of these items, combined with what we're seeing in much of the state and much of the country, suggests that we may be in for worsening numbers in the coming weeks. As we've seen in other states and counties, a worsening burden of disease often leads to a backstepping in phasing and opening up and increased damage to the economy and the community. We do have an opportunity as a community and as individuals to slow transmission and prevent worsening burden of disease. As individuals, we can take time to consider the safety of the events we engage in every time we leave our home. Unfortunately, this is the world we are currently living in and will be in for some time to come. Questions like who will you interact with, where will you be, how long will you be there? If it's possible to minimize the number of people, do activities in the open outdoor space, and minimize your time in close contact with others, that will minimize your likelihood of getting COVID-19 or unknowingly transmitting the disease. And really, we as a country, a county, and as a community must move past the debates on mask usage. Multiple studies have demonstrated the utility of masks in slowing the transmission of disease. It's a small step to take, a minor personal sacrifice, really in a time when our healthcare workers, our frontline workers, our essential workers are making far greater sacrifices and taking increased risks to keep our community moving forward. Just wear a mask. We as a community and as individuals can be proactive in slowing transmission and must act now before we're forced to act by untenable case counts and overwhelmed hospitals. Thank you and stay safe.
Thank you, Dr. Weston. And now we'll hear from Director Rausch.
Good afternoon, everyone. It's my pleasure to join as one of the suburban health representatives from the Greenfield Health Department. I have the pleasure today to talk with you about the data, and just echoing the same sentiments and conversation that Dr. Weston just had, the data is definitely trending in the wrong direction. So let me go ahead and share my screen here, and you will see the current week's data. So as Dr. Weston mentioned, we have over 190,000 tests performed, just under 15,000 positive tests in Milwaukee County. We trend new cases a lot, and we've talked about this time and time again. We had a notable peak in mid-May that was very noticeable in the city of Milwaukee, and we're certainly not quite there yet, but approaching that peak right now within the last couple weeks. I want to know, most alarmingly, that we have reached the highest number of cases in the suburban communities that we have throughout the 4 months of the pandemic thus far. And that's something that's certainly trending, continuing to trend in the wrong direction. So cases are up, as we've talked in the past. Deaths continue to be down, but as Mayor Barrett said, that doesn't mean deaths aren't occurring. So we need to be very cognizant of the fact that we don't just dismiss COVID because it's not killing anyone. These numbers are still people, and the deaths are significant. We've talked a lot about our growth rate over time, and we've looked at the reproductive number, or the transmission rate. And this graph essentially is showing that we started out very high during the early parts of the pandemic. We went down dramatically due to safer at home and a lot of those measures that we put in place in March and April. We had some increases back in May, and notably, I will remark that in July, here again, we're seeing increased transmission within Milwaukee County. Currently, our transmission rate is 1.38, which means for every one individual who has COVID, they will, on average, infect 1.4 other individuals. So that is a transmission rate that is increasing the outbreak in our communities. This week, for the first time, we further broke down that transmission rate by both the city and the suburban communities. And you see the city of Milwaukee on the top, the suburban communities on the bottom. And as I said, the growth rate of COVID in the suburban communities is exceptionally high, and our transmission rate in the suburban communities is higher than that in the city of Milwaukee. And you will note here that this peak is right around the 3rd of July. And so we do anticipate to see a little bit more growth in that peak in the coming weeks, because we know there's been a lot of transmission happening in and around our communities. We've talked a lot about age growth, our age rates, and growth of COVID in that age population. And we've seen another significant increase amongst those who are 18 to 39. And they continue to be not only now the leading number of cases, but they're driving the rates of COVID cases. So the rate of disease amongst those who identify as 18 to 39 years old has surpassed that of our oldest age groups. And that's certainly something to make note of. Lastly, I'll look at, or second to last, we'll look at testing coverage. Again, we continue to see tests increasing, and that's good. Almost 22,000 tests in the last week. And the positivity rates continue to climb a little bit. You see here on figure 13, but in the 14-day trend, we see an upward statistically significant increase in percent positivity. And that's something that we're watching as we look at that as a metric to open up again. And unfortunately, that is continuing to trend in the wrong direction. And lastly, I'll leave you with the case map of what's happening in the current week. This is the COVID incidence rate of new cases between July 8th and July 14th. And you'll see pretty widespread activity throughout the county, especially in some of the southern suburbs and even in some of the northern suburbs. So just again, showing a lot of COVID activity in and around our community. And that's something we need to be very cognizant of. I echo all the sentiments of other speakers. Wearing cloth face coverings is important. Maintaining social distance, staying home except for essential trips is all very important as we try to prevent COVID from continuing to run rampant in our communities. So with that, I will end because I know we have some other speakers. I'll turn it back to you, Catherine.
Catherine, you're on mute.
Wow, thank you. All right, it's all in due time. So Darren, as you unshare your screen, we will hear from Tia Ostrike, who's our bilingual psychotherapist with 16th Street. Tia, thank you for joining us.
Hi, thank you. Yeah, my name is Tia Ostrike, and I am a therapist at 16th Street Community Health Centers. I work in our substance use and behavioral health departments. So to speak a little bit about stigma of seeking mental health care today, I thought about some things that I've heard from clients. I have heard clients say, if people knew that I was talking to a therapist, they would think that I'm crazy, or I must be weak because I am seeing a therapist or taking medication to help manage my mental health needs. And I think it is so important to first denounce those things and to really normalize seeking mental health care in the same way that we seek medical health care if we need help with a medical health need. I think it's important when working with clients to explain my role and to say that, it's my job to provide a non-judgmental space for my clients to discuss and reflect on their experiences and thoughts and feelings. And I think most people could agree that at some points or another in their life, that it could be helpful to have that kind of space that is non-judgmental and a place to reflect and to do that processing of whatever's happening for you. I think additionally, it's important to discuss barriers, and in my experience, in particular to the Latinx community, I think it's important to acknowledge a barrier of language. In my personal practice, it has been extremely powerful to be able to speak a second language and speak with clients in a language that they feel most comfortable and most confident. It is already vulnerable to seek mental health care, and so to be able to do that in a language that you feel most confident is really, really important. I also want to bring up the potential barrier of insurance, as well as documentation or immigration status. That could likely be a barrier for someone in the Latinx community for seeking mental health care. And it's important to know that at a clinic like 16th Street Clinic, we serve individuals who are uninsured, underinsured, as well as have insurance. And so that does not prevent you from receiving mental health care. And similarly with documentation or immigration status, that also, we work with several individuals with varying immigration or documentation status, so that does not prevent you from receiving mental health care. I think it's lastly important to note that there is a certain level of privacy as well that exists in receiving mental health care. And so to feel that that is a protection as well, and know that if you are seeking care. Thank you.
Thank you so much for joining us and sharing those resources. We'll now hear from Long Shang, project coordinator with the Hmong American Friendship Association.
Well, good afternoon, everyone. Again, my name is Long Shang, the project coordinator at the Hmong American Friendship Association in Milwaukee here. The organization has been incorporated since 1983, helping the Southeast Asian community in the greater Milwaukee area, for years like that. And then myself, working here also, and beside being an interpreter, translator for over 20 years too, within the Hmong community, and I have seen a number of instances in regard to some other issues beside the mental health issues here. And I think in order to talk about the mental health, I'd just like to take a little moment here to give you a little background about the Hmong first, to understand how the mental health issue do exist in the Hmong community, just like anybody else too out there. But back in the Vietnam War era, the Hmong were recruited by the American CIA to fight the expansion of communism into the Southeast Asian peninsula, and then to rescue down American pilot down on the jungle in the mountainous area in the northern Laos. And so back then, during the whole Vietnam War, 15 years, about around 35,000 Hmong died. But after the fall of Laos in 1975, into communism, that the Hmong faced persecution for siding with the American and also for fighting in the secret war. The Hmong had to flee out of Laos. And so during the whole fleeing process here, the Hmong faced a lot of obstacle, and an estimate of 50,000 Hmong died during the whole phases of 1975 to about 2000. So the Hmong start to flee from Laos from 1975 all the way to about 2008 in many different phases as refugees into America. So we do appreciate it, the opportunity to be rescued by the American government here to come to this country. We do appreciate it. And as being refugee, and also with a lot of language barrier, sure, we face a lot of issues, then causing a mental health issue on that. And talking a little bit about mental health, it does exist, but just that it's something new to the Hmong. For example, the mental health, we deal with the brain, but then in the Hmong, we don't have vocabulary for mental health at all. And we said Marsha, which is about the liver now rather than the brain. And so Nuasha, Lusha, Susha, it's all about the liver, but somehow that's related to the brain, definitely. But it's the lack of vocabulary, lack of the language, technical terminologies. It's very difficult. And as an interpreter too, being out there in the field, helping clients, helping patients out there with professionals, mental health professionals out there, it's very challenging. And I think the stigma of the challenge for the Hmong is, definitely is to understand that is really something that we do need to seek help from mental health professionals in order to help in this situation like that. And so last year, we had the Hmong American Friendship had a project, and thanks to the Department of Health Services from the state of Wisconsin, and in partnership with WOCMA, which is a Wisconsin United Coalition of Mutual Assistance Association in Wisconsin. It's an umbrella organization with 15 other Hmong organizations throughout the state here. We work together. We got this project together, and also in partnership with the Milwaukee Nyozhong TV, and we did spread out the word that yes, mental health does exist within the Hmong community, and it's important to really get help. It will not get well by itself. We have to get professional help and all of that. So the Hmong face a lot of challenge, and then along with COVID-19 here, that's another issue on top of just the challenges that we do have already. And but thanks to all the officials, the elected officials who really put importance on this particular issue to really make sure that our citizens, the Hmong community also, do live well and safe. So we do appreciate that.
Thank you, Lung, and we appreciate having you on today's briefing, sharing those challenges and sharing the resources that you're using to reach our Hmong community. So we really appreciate it.
Thank you.
We'll now move to the question and answer portion of our briefing. Our first question comes from Mark Stevens with CBS 58, and he has two questions. The first question is for Mayor Barrett, and he says, how many health department staffers are going around checking on businesses for mask compliance?
Well, Mark, I can tell you over the weekend, and this is before the mask requirement went into effect, our health department staffers visited 94 different businesses throughout the city of Milwaukee to check with compliance on the distancing, the social distancing, and the capacity issues. I don't know exactly how many individuals that translates into, but we went to 94 businesses. What was most telling to me was of those 94 businesses, there were only 4 that they had concerns about. And I was very, very pleased that we're seeing such great compliance from our local businesses. And I think that's one of the reasons you might see a lower growth rate in the city of Milwaukee than you do in some of our suburban areas, is that with our distancing rules and now with the mask rule coming in, I think that that's going to have an impact. In terms of teams dedicated to the mask ordinance, a couple of points that are worth mentioning here. One is you are correct in assuming that the enforcement is through the health department. It is not through the police department. And that was very intentional. This is, for us, not a criminal issue. This is a public health issue. And we didn't think it was appropriate to bring the police into this. We felt it was appropriate to have our public health workers. We also want to stress that this is an educational effort. We want people to wear masks, not only for themselves, but for the people who they come into contact with. And the mechanism for enforcement is really contacting the health department, and then they will go out and they will do a educational component, if you will. And if the businesses are not complying, that's when the fines would start to accumulate. So again, I can't give you an exact number because I don't know the exact number. I don't know that I would characterize it as we have a team that's a team or teams that are out there looking for people wearing masks or not. We do, as I noted, have teams out there that are going into establishments to make sure that they are complying with the rules of the different phases, and in particular, the phase we're in right now.
Thank you, Mayor Barrett. Mark's second question is for Director Rausch, and he says, given the larger increase in cases in suburbs, are there more discussions to implement mask ordinances or backtrack on reopening plans?
I think the best answer to that question is everything and anything is on the table. So we have had various vigorous conversations about where the rates are going, where they're trending, and whether we need to pull back or maintain the status quo. And we review that once a week. So again, my colleagues and I will be talking about this tomorrow morning, and we'll see what makes sense as far as moving back. We'll need to look at the data a little bit more. In relation to masks, I do know some suburban communities are moving forward on masks. I believe Shorewoods went into effect last week. I am hearing that some other communities are talking about that, and I think that's going to get a lot of attention in local communities, but I certainly can't predict how that outcome is going to be. If it's driven by ordinance, that requires a vote of the Common Council or the village board, and certainly that would have to be taken up at a future Common Council or village board meeting for the cities and villages in Milwaukee County.
Thank you, Darren. Our next question is for County Executive Crowley, and it comes from Terry Sater with WISN 12. He asks if you can provide more context about the Bradford Beach water closure.
Absolutely. So the Bradford Beach water closure is a result of poor water quality. Yesterday, we received a lot of different types of rain. And so after testing the waters, we have basically given an advisory to say, do not swim in our beaches due to that poor water quality. So that is the reason why we have closed down the beaches.
Thank you, County Executive. Our next question is from Sean Kirby with Wisconsin Health News. He asks, there have been reports of an increase in opioid-related deaths during the pandemic. To what degree is Milwaukee County seeing an uptick in opioid deaths, and how has COVID-19 exacerbated that? Is anything being done to address the uptick? I'm not sure if our guests or our health professionals have a response to that, or our electeds.
So I can start off. So we're certainly seeing an uptick. There's no question. Milwaukee County, unfortunately, is on trend right now to have a higher number of total drug deaths and specifically narcotic-related deaths than we've frankly ever had since we started tracking the data. We're also seeing from an EMS perspective, we talked about this a few weeks ago, but we have more of the same data to share that when we look at our mental health calls to the 911 system, our overdose calls, our suicide attempt calls, we're seeing increased numbers specific to overdose between 46% all the way up to 86% increases year over year compared to last year. I think without a doubt, it is related to COVID-19. We see more necessary physical distancing, but it also exacerbates mental health conditions. And then I think there's no doubt that the anxiety, the isolation, the worry over COVID-19 has major impacts on people's mental health.
And I would say that we are doing everything that we can to make sure that we're reaching out to individuals. I mean, that's one of the reasons why we've launched the We Care Crew, and one of the reasons why we're also investing into behavioral health division to make sure people are getting access to the services they need.
Thank you both. And I don't know if our guests here along, if you have anything to add as far as clientele and challenges you guys have experienced as far as substance abuse.
Sure. I mean, I guess I don't know that I have much to add besides to say that we are always accepting new clients, and we do have a AODA substance use program at 16th Street. The phone number for the clinic is 414-672-1353, and you can call and go through a sort of brief intaking, get an appointment as soon as today. So I would encourage anybody to do that who is considering treatment.
Thank you, Tia. All right, our next question is from Tim Vetcher with TMJ4. And Tim says that it's for the mayor or anyone else who can speak to it. We know that Milwaukee Public School has a plan to start the school year virtually, but are public schools in the city able to hold in-person classes starting next month or in September if they choose?
So under the current health phasing that we are, no, they are not. Although we've gotten a lot of calls just over the last 48 hours, I think there's a lot of schools that are concerned about this. And I think what we need to do is we need to have some of our education leaders sit down with the leadership in our health department to see how they can craft together something in a way that's acceptable. But I think my personal belief is that this remains probably the most fluid issue that we have right now. And what I mean by that is I know that there is a huge appetite for schools, whether it's elementary schools or high schools or at the college level, for in-person classes to begin, particularly because I think people are concerned about what's going to happen to these institutions if they don't have students in the seats. at the same time, we're still in a pandemic. And from the other side, I hear from teachers who say, well, what happens if one of my students tests positive? Does that mean all the kids in the classroom have to be quarantined? Does that mean the teacher has to be quarantined? So I think for all of the conversations that are going on, I think that this is going to remain a very fluid issue, not only over the next month and a half or when schools begin, but even after schools begin. So I think the most important thing we can do right now is to continue to have the open and very frank conversation about what's the best way to make sure that our students aren't falling behind, but at the same time, make sure that we're keeping the students as well as the staff safe.
Thank you, Mayor Barrett. Shepherd Express is asking Mayor Barrett again regarding the Restart Grant Program. Is there a plan for a second phase to get additional funds into the hands of Milwaukee businesses?
We are certainly open to that. What we had done initially is we had allocated $20 million. As I said, in our first rush of applications, we allocated $4 million. So we still have money that is available for that program. So we have had conversations internally, and we're trying to decide what is the best mechanism now. But that possibility certainly does exist. Yes, we've been very pleased with the response to the program. Again, what I liked more than anything was that every single part of the city had businesses that applied for it and received money. That's something that you don't always see. We saw it in this one because it was geared towards small businesses, those businesses with less than $2 million in income and 20 or fewer employees. So that means a lot of neighborhood businesses have been able to benefit from this. So stay tuned, I guess, is my response to that.
Sounds good. We will. Mark Richards with Wisconsin Public Radio has our next question, and it's for Director Roush and Dr. Weston. Do you have demographic data on hospitalizations? He's wondering if there has been a corresponding increase in 18 to 39-year-old hospitalizations, or if more from that age group are recovering from COVID at home.
Yes, that's a great question, and I do have data, so I'll just go ahead and share that page of the data report, and I'll just remind everybody on the call they can get that report through Catherine after the call. So what's on the screen currently is the cumulative hospitalizations in Milwaukee County, and in the upper right here we have the hospitalization graph by age group. So you can see here that our highest age group for hospitalizations has actually been the 60 to 79 age group, followed by the 40 to 59 age group, and then followed by those 80 plus. So obviously those who are older are having more hospitalizations still. Those under 18 haven't been hospitalized at a very high level at all. This is pretty flat. It's not zero, but pretty flat. And certainly the cases in the 18 to 39-year-old age range has been increasing pretty steadily since May. Similarly, hospitalizations have crept up, but certainly that's not the highest group that's being hospitalized for COVID currently.
You're on mute again, Catherine.
All right, there we go. All right, here we are. Our next question is from Nick Williams with Milwaukee Business Journal, and it is for Mayor Barrett. He says, with the mask mandate now in place, will the city try to stay in its current phase 4 of moving Milwaukee forward reopening plan, or go ahead with moving to the next phase and lift restrictions if the indicators are moving in the right direction?
Well, you're correct. We are in phase 4, and just in the conversations we've had with the health commissioner, she anticipates it will remain in phase 4 for some time. But this is always guided by the science, and it's guided by the indicators that we see. And again, if I had my druthers, we wouldn't even be talking about phases. We'd be life back to normal. But we're going to continue to follow the science, and that's why we listen so much to Dr. Weston and to people like Darren Roush, because they're the ones that do this as a living, and they're the ones that have a sense as to what can be done.
Thank you. And our next question is from Fox 6, and it's for our health officials on the call. They're asking, what metrics should schools be using to determine when they should start in-person learning? Is 14 consecutive days with no COVID cases in the county reasonable?
Well, I will point out that we have not in the last 4 months had even one day without a COVID case. So I think 14 consecutive days without COVID cases would be probably just short of a miracle. So knowing that COVID is going to continue on in our communities until we get a vaccine at some level, I don't think that's the best metric to look at, but certainly we in the suburban Milwaukee County, with our regional partners, with our state partners, are looking at those metrics and looking at those rates of disease in our community, because those are going to drive a lot of the school reopening and the school closing and other things that are going on in our community for the next several months.
Yeah, I would agree. I think that 14 days seems very difficult to achieve. I think these are, as Mayor Barrett discussed, as Director Roush discussed, these are decisions that the schools must make in conjunction with their local health officers, the dynamics that are going on in their community, the new research that continues to come out. The latest research seems to suggest that transmission from children is less likely than transmission from adults, which is different from most other kind of upper respiratory diseases that we've seen in the past. So we continue to learn new things about COVID-19. And so that collaboration between public officials as well as school officials is going to be really important.
Our next question is from Mayan Silver with WUWM. And perhaps Mayor Barrett, you might be able to answer this. She's asking, what's going to be the policy with masks on the lakefront? Should bicycle riders and runners be wearing masks? Should walkers wear masks on the lakefront, as people can't always stay 6 feet apart?
Well, again, common sense is going to come into this a lot. We're not going to have the police patrolling, and I don't think the county executive is going to have the sheriff, or the sheriff himself is not going to have his deputies out there patrolling this mask brigade, if you will. But the rule is, and the law is, that if you cannot maintain social distancing of 6 feet, you need to wear the mask. It's pretty straightforward. And I've been past the lakefront several times over the last couple of months, and clearly it's much more difficult to maintain that distance at the lakefront than it is walking through my neighborhood here. So I see people walking through my neighborhood. I walk through my neighborhood, and oftentimes I don't wear a mask if I feel that I can stay 6 feet away from people. I have my mask with me at all times in case I do run into somebody I know and I engage in a conversation. But this is, again, we are asking people to use common sense as much as anything. That's the goal. Again, when you're at the lakefront, it's much more difficult to have that 6 foot difference.
Thank you, Mayor. That concludes the questions. Oh, well, one more from Virginia Small, a freelance reporter here in Milwaukee. She asks, MPS is going to online learning. Does Mayor Barrett or anyone know about any efforts to increase access to Wi-Fi for those without access in the home?
I do know something about this because I've worked with Superintendent Posley directly on this issue going back to the springtime, because right off the bat, I mean, literally right off the bat, we could see that there was going to be a serious problem with access to people who live in neighborhoods, sometimes where you don't have the hotspots. It appears that the computers, if you will, the hardware, is not as serious a problem as the connectivity. Now, having said that, there's also the reality that you might have some homes that have 2, 3, 4, or 5 computers or access through their devices, and then you might have another home that might have 1 and have 4 kids. And so that's going to cause, this is where the equity issues come in. And I am very concerned about that. I know Tina Chang, for example, has worked closely with us at the city and is also working with the Milwaukee Public Schools Foundation to raise money to make sure that we do not have more problems with the learning gap, and the connectivity is a big part of that. So that is a real issue that I think we all have to be mindful about and have to do something to address.
And I would absolutely echo the same comments as Mayor Barrett. We have been in conversations with MPS as far as what we can do to help assist as well. And as well as other school districts around Milwaukee County.
Excellent. Thank you both. Very important issue. And Mayan Silver with UWM snuck in one last question here. And County Executive, maybe you can speak to it. She's asking, would you ever contemplate shutting down the lakefront if Milwaukee keeps trending in the wrong direction?
I think absolutely. I think Director Ross pretty much hit the nail on the head when he said everything is on the table if we continue to trend in the wrong direction. We have to look at the science and the data, and we will continue to do that as we look at what to do with our beaches.
Well, thank you all. I think that's our last question for today's briefing. And thank you all for your patience during my challenges with mute today. We all have those days. So with that, that concludes our briefing. Have a fabulous weekend, and we'll talk all next week.
Thank you very much.
Everyone.
Take care.
Thanks.